Cases now stand at 1,161 after 52 more people tested positive for the disease.
Nairobi has for the second day recorded the highest number, with Kibra now being an area of concern following increased infections.
The government says further containment measures may have to be taken in the populous area.
The 65th COVID-19 briefing, and this time round not at Afya House. Machakos County hosted officials from the Ministry of Health on a day that COVID-19 cases rose by 52.
This now brings the total to 1,161 persons who now tested positive.
And yet again, a majority of the new infections were confirmed in Nairobi, which recorded 23 cases. Mombasa has recorded 7 cases, the same number as Busia. Kwale has 5 cases, Kajiado 4, Nakuru 2. Kiambu, Taita Taveta, Kilifi and Trans Nzoia have each recorded 1 case. In Nairobi, Kibra, which recorded 15 cases on Wednesday and 13 cases on Thursday, recorded the highest number of new infections in the county yet again, with 8 cases.
And that is something worrying, considering the population that is in Kibra, and further measures may need to be taken.
At the Kenya-Uganda border in Busia, this was the situation on Friday. A snarl-up of trucks stretching over several kilometers. Drivers say they have undergone COVID-19 tests but have not received results 4 days later.
Leo hii mtu anakuambia paka majibu ndio uendelee na safari. Ama majibu tutatoa kwetu majumbani, ama majibu tutatoa shambani, ama majibu tutatoka wapi?
Nimepimwa saini mara 7 na kuna matokeo imeshaikuja hata moja.
The government requires truck drivers to be tested 48 hours before travel. But on the ground, things are different. Testing, truckers say, is slow, and getting results is even slower. And on the Ugandan side, they say the situation is risky.
Tuna tatizo kubwa sana kuelekea upande wa Uganda. Huwezi simama ukakojoa, ukijaribu kusimama ukakojoa unapigwa mawe.
Hakuna duka yenye unasimama tununue soda. Ukisimama kwa duka wanakushout wewe ni corona, wanatoka na mawe.
Mutai Kagwe says the country now has enough capacity to produce personal protective equipment and will stop importing PPEs. And on Madagascar's supposed COVID-19 cure.
And the last thing I am going to do in this country is to allow anybody with any form of concussion to come and profess that these things are working before they are tested by our people.
In the last 24 hours, 5 more people were discharged, bringing Kenya's total recovery cases to 380. Rita Tinina, KTN News.
For over 2 months,